Hair loss is not a single disease. That is the reason why most hair treatment fail. If it was a single problem, one tablet or one oil could have treated it. Today, I will explain you that why these treatments fail. I am Dr. Samiksha Tyagi, plastic and hair transplant surgeon. In this video, I will tell you why you are losing your hairs. I will explain you about hair loss, that too in a language that you will understand, so that you know what is happening to your hairs. Most people think hair loss means baldness. Some think that hair loss is because of vitamin deficiency. Others think that it is some oil or control of your stress can completely treat your hair loss. But actually speaking, hair loss is not a disease, but it is a symptom. Now let's see in detail why hair fall occurs and what are the various causes that leads to hair fall. The most common cause of hair loss is androgenic alopecia, which is also called as genetic hair loss. Similarly, other terminologies are male pattern hair loss or female pattern hair loss. If you see the hair loss pattern in genetic hair loss, it is progressive and gradual thinning of hairs, and which is occurring in a patterned way. That means usually the hair loss starts around your frontal or temporal area. Sometimes it is seen around crown as well, and gradually as the stage advances, the frontal, temporal thinning and crown area merges, which leads to advanced grade of hair thinning and hair loss. This genetic hair loss occurs in males as well as females both, but usually in female the hairline is preserved and hair loss is mostly seen over the frontal and the crown area. Now moving to the next cause of hair loss. Another very common hair loss pattern is telogen effluvium. Telogen effluvium is a condition in which there is sudden generalized hair loss which occurs after some condition in the body like stress, illness, pregnancy, sudden weight loss and many more. Usually during telogen effluvium, your hairs in the growth phase, they suddenly go to the resting phase or shedding phase. And that's why you see you are shedding lot many hairs. It can occur at any age group and both in males and females, but it is more common in females. Telogen effluvium can be acute or chronic. If it recovers within 6 months of time, then usually it is acute. And very rarely it is chronic when it prolongs beyond 6 months time. The next common hair loss condition is alopecia areata. It is a condition in which you see sudden acute onset hair loss, which can be patchy, or sometimes it can be involving the entire scalp, or rarely it can be involving scalp as well as body hairs. These conditions are usually self-limiting, but it causes tremendous stress. But with treatment, many times this condition can be further prevented and treated in timely manner. The next very rare cause of hair loss is scarring alopecia. It is a condition in which due to various medical causes, hair follicles undergo permanent scarring and they are destroyed. Though it is a rare condition, but it needs proper diagnosis and treatment to correct this problem. So in all this condition, as you have seen, the hair loss is a common thing, but causes are different. That's why it is important to understand why you are shedding your hairs. This is where people make mistake. Using an oil for genetic hair loss, it will not help you. Following someone else's treatment will not be a useful treatment for your cause of hair loss. Taking multivitamins for hormonal problem is again wastage of time, or even getting a hair transplant for stress related hair loss is a big disaster. So always remember, do not follow social media advice for your hair loss problem. Never try someone else's treatment. And early diagnosis will save your hair follicles and your hair roots for a longer time. If you want science-based hair guidance, subscribe to this channel. Thank you.